Welcome back. Day 20 of the 27-day mobility challenge here at the Reprogram, and we are moving on to the lower body, looking at these essential range of motions necessary for us to perform in a healthy way and maintain our vitality and our well-being. And if we want to start a physical training regimen or a program, an intense program, or even just being physically active during the day, performing day-to-day tasks, maybe your job or your occupation's physical, maybe you're a tradesman or a carpenter, and these are the range of motions necessary that you need to offset injury and joint pain and problems, okay? So what we're going to look for today is the hip flexion capability, okay? So looking at the hip, testing the posterior chain length, the hamstring length, and do we have the necessary amount of hip flexion necessary to avoid these common problems like hip impingement, patellofemoral pain, lower back pain, and even hip flexor tendonitis, piriformis syndrome. There is loads of them. Because the hip is such a primary engine in our movement, when the muscle balance is off around the hip, we really see compensations in the lower back, the knee, and in the hip itself. Okay, so again, like I said, the joint upstream is lower back, so you're looking at all that sort of tension, that compensation. If we're missing that hip flexion and the ability to anteriorly tilt the pelvis, we end up, when we bend over to pick something up, or when we are sort of standing up straight, if they're super tight, we'll be sort of living in this posteriorly tilted position, which is where basically the lower back just doesn't move, and those QL muscles and those spinal extensors just live in overtension. Particularly when we do bend over to pick something up, we load the lower back muscles and the lower back, those vertebrae, kind of making them extra hip joints because we can't get that rotation in the hip to maintain a neutral spine. So, and use those hamstrings and that posterior chain to actually pick up whatever we're trying to pick up. We end up losing the lower back instead, and that's where we get these herniations, these chronic lower back pain, etc., etc. And then moving into the hip itself, like as mentioned, we get hip impingement, we get piriformis syndrome. Like if we're living in this posterior tilted position, we're also living in a bit of external rotation as well. So that would, over time, that's going to adaptively shorten the piriformis and the external rotators, and that's going to bring on that piriformis syndrome, sciatica, so that's not nice. And then moving downstream to the knee, we're looking at patellofemoral pain, iliotibial band syndrome, because remember, if we're stuck in this posterior tilted position again, or we're limiting hip extension because the hamstrings are so tight, particularly if we've got a bent knee, it's okay, but with a straight knee, like whenever we walk, or like sort of if we're walking up a hill particularly where we need that extra bit of extension, it really starts to interrupt with the natural external rotation of the femur, and it puts a lot of tension on the iliotibial band, that tensor fascia lata, and the gluteus medius. Okay, so it just doesn't get a chance to offload. So we really feel it in that lateral side of the knee. Okay, so as mentioned today, we are going to perform a modified version of the straight leg raise, testing hip flexion in a straight leg, and we'll show you that now. All right, so this is the straight leg, or the modified version of the straight leg raise. Okay, and here we go. So what we're going to do is you're going to basically start in a kneeling position about like a couple of feet away from the wall, and you're going to bring your front foot up against the wall so you have about a 45-degree angle from the heel to the wall. Okay, obviously it's not going to be flat against the wall. And you want to make sure, one of the key things is to make sure that this leg is in as much extension as you can get it, okay? So you'll feel a stretch on the front of this leg's hip flexors, okay? Try and squeeze the glute if you can at the same time. And what you want to do is you want to place both hands against the wall, and without letting the hands come off the wall, you are just going to straighten this leg, okay? So the hip will shift back a little bit, but you're just going to straighten this leg like so, okay? And that would be a pass. So what we're testing here is usually with the straight leg raise, you're looking for a 90-degree hip flexion from the floor. So a traditional straight leg raise would be you lying on your back, and then you lift your leg up to a 90-degree straight leg, and that would be a pass in clinic. But the Reprogram, we like to go one better. So we're kind of looking for around 95 to 100, okay? Because again, that allows us that little bit of compensation space, which we always like to see, what we like to look for. So about 100 degrees, you can see I'm slightly flexed, a little bit more flexed than 90 degrees, and then keeping that tension on the hamstring, not letting my back round, allowing the hip to anteriorly tilt, and stay, keeping my lower back in this nice neutral position, okay? And that would be a pass. Now, a fail would look like this. If as I pump, my fingers come off the wall, okay? Because I just don't have that range of motion to allow that hip to shift back a bit. My fingers end up extending, or some people can't even reach the wall, okay? So that would be the first sign of failure. Others would be a really excessive shift back, so they kind of go like this, right? Or another one is where this knee just does not straighten. We don't get that length, okay? They stay in this position and they go, all right? So that would be a fail, okay? And that is the modified version of the straight leg raise. And as always, you can find all these movements on the website. If you click on the Get Started button, register, and you can perform the whole movement screen, the movement assessment for free. Find out where you're at risk of injury. If you are suffering pain, it will tell you a little bit as to why. It shows you the main cause, and it shows you the indirect risks as well. So, you know, if everybody could do this before starting a physical training program, there'd be a lot less injuries in the world and a lot less pain. That's it. If you like what I'm talking about, if you like what you're hearing, you want to find out more, check us out at www.thereprogramonline.com. We'll see you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine your life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength, one step at a time. Let's get started.